The heart normally beats 60 to 100 times a minute, but atypical heart conduction generates abnormal rates or rhythms called arrhythmias. Heart rate varies with activity, but when the sinoatrial node's firing rate changes abnormally, sinus arrhythmias occur. Tachycardia, above 100 beats per minute, and bradycardia, below 60 beats per minute, each reduce stroke volume and can lower cardiac output. Re-entrant circuit arrhythmias form when electrical impulses travel in circular pathways, causing repeated stimulation. Heart block arrhythmias are caused by obstructions in the conduction system that delay or stop electrical signals. With normal heart conduction, heart blocks and re-entrant circuits can cause the atria and ventricles to contract independently, decreasing cardiac output. Typical arrhythmia symptoms include chest pain, weakness, and hypotension. Cases with severely lowered cardiac output can be life-threatening.